eye disease treatments?
A very good morning, everyone. So I'll be presenting our work on efficacy and safety of weekly EUGOGO protocol versus 3 weekly low-dose intravenous methylprednisolone in thyroid eye disease, a prospective randomized controlled trial study. We have no financial disclosure. Well, thyroid eye disease is a sight-threatening condition where the most important pathology mechanism is the activation of the orbital fibroblast. Management of thyroid eye disease is based on two parameters. One is the clinical activity score and second is the severity. So if the clinical activity score on presentation is more than 3 out of 7, it indicates it's an active disease. During follow-up, if it is more than 4 out of 10, it is again includes that it's an active thyroid eye disease. The severity of the thyroid eye disease is classified into mild, moderate to severe, and very severe or sight-threatening disorder. So based on this background, the purpose of our study was to compare the efficacy and safety of two corticosteroid regimens in moderate to severe type of thyroid eye disease. These were our primary and secondary outcome measures. We did a prospective randomized controlled trial study. After baseline examination, clinical activity score, radio imaging, the inclusion and exclusion criteria were the following. So the treatment regimen, we had 146 eyes of the 88 patients. They are all underwent simple randomization procedure. The first group was the group 1. They were divided into two groups. Group 1, which was 3 weekly dose. So the first pulse was given 500 milligram for 3 days, making it 1.5 gram. This was followed by every 3-week cycle for the next 5 pulses, making it total of 4 gram. The second group were the patients who were undergoing EUGOGO protocol. So the first 6 pulse was 500 to 750 milligram for 6 weeks, and this was followed by 250 or 500 milligram for next 6 weeks, with or without immunomodulation. The baseline characteristic of both the groups were nearly similar. However, the compliance was much better with the 3-weekly group compared to the weekly group. Both the groups nearly needed the same amount of immunomodulators. The baseline visual acuity was also similar in both the groups. The visual acuity improvement was also nearly comparable in both the groups. The reduction in the clinical activity in both the groups were comparable and clinically significant. This was a patient who had clinical activity score of 5 out of 7, who underwent 3 weekly cycle, and after that the activity score was 1 out of 7. This was the patient who underwent a weekly cycle for the weekly EUGOGO protocol, and after the treatment the CAS score was 0. The reduction in proptosis in both the groups were comparable, and this was also clinically significant. This was the patient who had left eye proptosis of 26 millimeter, and after a weekly cycle, a EUGOGO protocol, the proptosis has reduced to 22 millimeter. This was the second patient who had right eye proptosis 26 millimeter. He underwent 3 weekly cycle, and the proptosis reduction was also significant, 21 millimeter. The resolution in diplopia was much better in 3 weekly cycle compared to the weekly cycle, and that was clinically significant. This was a patient who had inferior rectus hypertrophy, as you can see here, and the diplopia was present in the primary and the down gaze. He underwent weekly pulse cycle for the 12 with, along with mycophenolate treatment, and there was resolution of diplopia, and movements were also better. This was another lady who had gross proptosis and diplopia in nearly all the gazes. She underwent 3 weekly cycle for the 6 cycles along with azathioprine, and there was reduction in the proptosis and reduction in the diplopia too. The side effects in both the groups were comparable. If you look into the different types of randomized controlled trial studies, well, the one with the 3 weekly, the 4 gram, the one with the 4 gram was nearly the results were nearly comparable to the high dose monthly cycle, along with the lesser number of side effects, which were minimal and conservatively managed. So to conclude, 3 weekly low dose IVMP appears to be a promising and efficient therapeutic approach for thyroid eye disease. The administered dose of 4 gram when compared to the traditional weekly regime ranging from 4.5 to 7.5 gram is a comparable clinical outcomes. Enhanced patient compliance along with superior diplopia resolution and fewer side effects were the benefits of this part. And the streamlined regime not only simplifies the treatment process but also contributes to a more favorable patient experience, emphasizing the potential for improved overall management of thyroid eye disease. Thank you so much.
You should look for that job where in ads they ask people to read financial risk are subject to market. You are so fast, you were unable to catch a few words. But a couple of things. What was the need for the percentage of patients that needed immunomodulators? In both groups, were they comparable?
Yes, sir, they were comparable in both the groups.
Fundamentally, I had a question. If you are including patients who required immunosuppression, won't that be a confounding factor given that the drugs that they use for immunomodulation, the duration for which they are on immunomodulation differs, but the endpoint at which we are looking for resolution is the same. So that may be a confounding factor for both groups.
Sir, actually, we were not starting the immunomodulators from the beginning. At the 4th cycle and in the EUGOGO at the 6th cycle when we were looking at that. So depending upon the response, if there was activity was still there, or if there was suboptimal response, then only we were including the immunomodulators, not from the beginning, sir.
Right. No. So that point where you start or need immunomodulator is the journey that only corticosteroids have taken you for.
Yeah.
So that could have been the point to see how many patients have partial resolution, good resolution, or persistent disease after initial 3-weekly or the EUGOGO protocol.
We'll consider that for sure, sir. We'll
And
definitely
also,
consider that.
how many needed oral steroids in either group?
None of them, sir.
None.
Just one question.
Yeah.
In your inclusion criteria, did all these patients have active thyroid eye disease?
Yes, sir. Moderate to severe thyroid eye disease. Active.
Because in the photographs, most of them had surprisingly white eyes. Most of the patients also, not many had really congested, angry-looking eyes at all. They're all looking like chronic thyroid eye disease patients who would actually need surgery. So
No,
I couldn't see any angry-looking, congested eyes. Most of them looked very white and.
Maybe, sir, because of the color format. But
They're all new
yeah,
patients,
they
is it? New active thyroid eye
yes,
disease
yes, sir.
patients, is it?
New,
Okay.
new, live patients.